As a top-rated board-certified physician, Dr. Kristin S. Black is a trusted practitioner in innovative wellness solutions. Dr. Black is the owner and operator of New Day Wellness in Charlotte, North Carolina, and New Day Family Practice in Lancaster, South Carolina. After finishing her undergraduate degree in Human Development and Family Studies at Cornell University in Ithaca, New York, Dr. Black attended medical school. She earned her doctorate of medicine from Mount Sinai School of Medicine in New York City. Dr. Black also studied as an Arthur Ashe Fellow at Harvard University in Cambridge, Massachusetts, and is currently board certified through the American Board of Family Medicine. During her family practice residency at Carolinas Medical Center, now Atrium Health, Dr. Black won awards for outstanding family practice and community service. She trained extensively in internal medicine, pediatrics, and gynecology, focusing on providing care for the indigent and underserved. Dr. Black has special interest in women's health, bioidentical hormone replacement, weight loss, nutrition, and dietary counseling, and alternative medicine, to name a few. She maintains active roles in the community by providing workshops on adolescent issues, diabetes management, and cardiovascular disease, so patients can learn to live with vitality, energy, and passion. Dr. Black is married with 2 teenage children. She serves on the board of Children's Theater of Charlotte and is an active member of the South Charlotte chapter of Jack and Jill. She is also a proud member of Alpha Kappa Alpha Sorority Incorporated. Welcome, my special guest, Kristin Black. How are you?
I'm doing well. I'm trying not to cut up, Carmen. So,
girl, cut up. This is the cut up time.
I'm excited to be here.
I'm excited to have you here because I do know you cut up. That's why. And you're not afraid to cut up with me.
At all.
But yes, I'm so glad you're here. Welcome to the show. You have been somebody I've been wanting to get on this show for a while. And, you know, I hunt you down. We're
going to make it happen no matter what. This week, I'm like, okay, no excuses. I don't care what's going on.
Exactly. Because we're both so busy. And I mean, you know, you run a family practice, 2 practices in Charlotte and Lancaster, South Carolina. You have 2 teenage children. I mean, where do you find the time?
I still wonder that. One of the things that I need to do better, and I tell my patients to better, is I stay up till 1 or 2 in the morning. So do not do that. But, you know, we find the time as moms and as business owners, we find the time, we make it happen. That's what we do. So, you know, it happens. It's not always right how we do it or healthy how we do it, but we do, and we're all striving to be better. So,
yeah, absolutely. Absolutely. So tell my listeners and viewers a little bit about yourself.
Okay, so been down here in the Charlotte area for, I can't believe it, almost 20 years. But I'm originally from New York City. Grew up in Cambria Heights, Queens, which is a middle class Black neighborhood, and always knew that I wanted to be a physician. You know, growing up, our pediatrician in the neighborhood was like, that was the happening spot. Right? You got your candy over there, and he went to Howard University. He always just talked about like how important it was to be an integral part of the community and how being a doctor was the best thing in the world. So since I was 6 or 7, it's like I wanted to be like Dr. Hewlett because that was the happening spot. That's where you saw everybody. That's where, like I said, he was giving out candy, even though he was a physician. You know, that's where the moms and dads would gossip and everything. So in my mind, that was like, okay, I'm gonna have a practice where, you know, it's the nexus of the community where everything is going on. So, you know, when you're 7 or 8, you don't really know what that means. So the process of becoming a doctor was harder than I thought it was, but it was always in my mind that that's what I was gonna do.
That's amazing. That's amazing that at that young of an age that he had that much impact and impression on you. Did you ever go back and tell him? Does he know that you became a doctor?
Yes.
Really?
You know, well, he ended up passing away while I was in medical school, but he knew that I was on that path. So all throughout high school, he was that bug in my ear, like, you know, don't change course. You know, in high school, there's that time where you're making decisions and probably not the best decisions. And I remember him sitting me down and was like, look, this is not what we talked about. This is not the plan. So, you know, it may be fun, or you think it's fun doing this other stuff out here, but there's a bigger picture here. You know, what you're going to do is not going to just change the lives of you, but it's going to change the lives of your families and whatever communities that you're going to be in. So that was always in my mind. So even in college, even, you know, that process, because even in college, I had my first advisor, who actually was a Black woman, was like, well, maybe you should look into something else. Like after that first semester of college where you just totally blow it because you're in college and you're like, this is the best time ever. And you're doing things that you shouldn't do. So my first semester grades were like, you think you're going to be a doctor? And she was like, you know, you could go into other things. It looks like you focus well in psychology or sociology. And not that those are bad things, but I was like, look, lady, I'm supposed to be a doctor. And she's like, well, if you're going to be a doctor, this whole thing has to change. And those conversations that I had with him just stuck in my head. Like, there's a bigger picture here, and I need to get it together, get all the tutoring I need, all the help I need, you know, and change my path to get to that final goal.
Yeah. So it sounds like you had your why very, very early on, whereas other people may, you know, they develop their why later or identify their why later. You had that early on, and that's what kept you grounded and rooted, even when you were doing your freshman things that we all do. I think I changed my major in my freshman year too. So, you know, hey, it happens. So you knew you wanted to be a doctor from very early on, and you had the mentor who was there helping you. So now you're a doctor, and it's time for you, I guess, to choose a specialty or for you to go in a particular direction. Why women's health? What was so important about women's health that you decided that's where you wanted to go?
So technically my specialty is family practice. Going through medical school, and I loved everything, right? And I knew I loved talking to people. So I've always been a talker, always been the person that wants to get to the why of it, and just, you know, kind of nosy, and just love just the mix of everything. And I love all age groups, right? So I loved babies, you know, I loved delivering babies. I loved really adolescents and teenagers. And I loved older people. So I wanted the whole spectrum. And in New York, family practice wasn't that big. It was more of a Southern thing and maybe a Midwestern thing. New York is very specialized. So it's, you know, you pick a specialty and you run with it. You know, you're not going to the family practice doctor. But I guess I just knew I wanted to be involved with families and communities, kind of what Dr. Hewlett talked to me about. And so with family practice, I was like, I could jump off of that and do anything. So by doing family practice, I could do women's health. I could do adolescent medicine. I could focus on, you know, diabetes and hypertension and stuff related to the Black community, and work on disparities and all that other stuff and make a difference. It wasn't until I actually was working as a physician that I started to see that when women were hitting around 40, late 30s, 40s, but really 40s, mid 40s, 50s, things were changing dramatically, right? Women that never had depression were getting depression. They talked about just losing a spark, losing their umph, and not knowing why. So, you know, after the first couple of years, I'm like, this can't be just something that's happening to a few people. This has to be something that's happening a little bit widespread. And is there a better way to treat this, you know, rather than what we've already learned, like what was in our toolbox, right? So that was also around the time when traditional hormones were out. I don't know if you remember, but like there was a big study on Premarin, regular like synthetic hormones, and it scared women. Like those studies showed all kind of stuff. Like there was an increased risk of breast cancer, there was an increased risk of heart disease. They did this study that scared women outrageously for being on hormones, and they took a lot of women off.
Okay.
So, well, they took most women off if you didn't really need it. And
Okay.
then what happened was around that same time is when antidepressants were really getting big. So like Prozac and Zoloft and all of that stuff,
Was this
women
what,
were getting
80s, 90s?
like late
Early
90s, early 2000s.
late 90s. Okay. Early 2000s. Got it.
So what was happening is women were getting off their hormones too, which was compounding this. They were getting off their hormones, but then what was happening is they were coming in for depression medicine. They were coming in not being able to sleep. They were coming in with more anxiety. And you add that with what was going on with women in that age just already. And again, I was like, there has to be something different. There has to be a better way to treat this. And part of why I went to medical school is to be a critical thinker, is to come up with solutions for situations that's in our community that are happening to us. So I was like, okay, let me do a little bit of research and figure out how we can make this better and how I could treat this better. So initially, it wasn't just the women's health. It was like, okay, is there a healthier way to treat hormones? Is there a healthier way to, not even just hormones, are there healthier ways to treat a lot of the medical issues that we deal with?
Okay.
You know,
so back us up a little bit. So you were saying the women were getting off of hormones because, so why did they have to get on them in the first place? Can you explain that piece?
So again, so once we hit around 40 or 45, or if women were getting hysterectomies, everything was changing. It was like women were having crises in their lives, just not feeling like the people that they used to be.
Yeah.
And making that connection, is it really hormones, or is this really have to be when we get into menopause that we're just supposed to live with these changes?
Right. So most people would sit here and listen to you and they were like, okay, 45, 50. Yeah. Okay. A woman's getting older. A woman is hitting menopause. So that's naturally supposed to happen. A woman's supposed to feel this way. You're saying, you're looking at this and you're like, nah, there's gotta be a better way for women to live through this time. And so that prompted you to do some research into hormones.
Yes. And the hormones and other ways to treat some of these menopausal symptoms, and just to look at, what was really going on. It can't be that we hit late 30s, 40s, and we're all getting depressed or more depressed, or we're all having anxiety or more anxiety. That now we used to be able to sleep, we used to be able to lose weight quickly, and now we can't lose weight, and everything that we used to be able to do changed so dramatically. So it's like, okay, is there a connection? And if there is a connection, or even if there isn't a connection, is there a better way to treat these things?
Sure. Okay. And so what did you find?
I found that it wasn't easy. So to look outside the box in medicine is not always the route that you're told to go, right? So it's kind of like you have to be, I don't want to say a lone wolf, but you have to say, okay, I'm going to kind of go against the traditional way of doing things. And there has to be other doctors or other physicians that are having these same issues and same concerns. And how are they treating these things?
Right.
And then when you start to do other research, you find that in other countries, they do use natural hormones, or they do use a lot of alternative ways of treating things. And sometimes I think the United States, the pharmaceutical companies, there's so much money poured into that, that, we see commercials on TV now. We see doctors are targeted on what we prescribe and how we do things. And especially back then, because now there's a little bit more regulations, but there's a lot of stuff going on behind the scenes that I think that even that we don't realize and we don't know. So, I found that in other countries, they do use a lot of natural things to treat things easily. And that there were something called bioidentical hormones, or natural hormones, that were prescribed a lot more frequently than what they do here. And that there were even some things that were over the counter that you could get, but here you couldn't get without a prescription, or they made it seem like you were doing something outside of the box or dangerous, and that's not the case.
Right, right. So, okay, what are those hormones when you say bioidentical hormones and natural hormones? What hormones are they, and what do they do for women?
So those hormones, it's usually the big three, right? So it's estrogen, so estradiol or estrogen, progesterone, and then the big one that we don't really talk about in women, but I found is I think the most important is testosterone. Mm-hmm. Usually when we hear testosterone, we hear with men, we're in the car and you hear dun dun dun. If you have low T, come to the men's vitality clinic and we can hook you up with all these different symptoms. But with women, it's like this big bad thing that we're not supposed to have testosterone. Now, with men, their numbers are huge and there's all these products kind of targeted to them. But for women, it's we need small doses and small amounts, but a little bit can go so far. Yes. So I love that testosterone.
Yes.
And it makes such a difference in how you feel.
Absolutely. So I am a patient of yours. I'm letting that out freely. And you're right. So I came to you, I think probably around 40 and about 4 years ago. And I was like, you're like, how you feeling? I'm like, no, I'm like, I'm not well. I'm not well. I'm not feeling it, just a little tired. And then too, I thought that was just part of aging and part of just getting older. And maybe I thought it was partly my lifestyle at that time and the things that I had going on. Mm-hmm. Nevertheless, we went through our testing and I found out that I was low in some of those areas of hormones. Now, I never knew anything about hormones, didn't know anything about it, but I was like, you know what? I'm going to try it. I'm going to try this out. And so I was prescribed, the testosterone and the progesterone. And when I say that there was an amazing difference in how I felt, how I performed as far as like in my workouts, because I was working out. Everybody who knows me knows I work out. I was working out and I was losing no weight, no weight. And I was eating
clean, right?
Decent. I was eating decently and I just couldn't lose some of those extra pounds. And so getting on those hormones helped me so much. And again, the testosterone was something that was very, very key. And just in how it helped me, even with, just like clarity and just both of those two things that for me and what I was missing, having those back into my body and getting them back up to a decent level just changed my whole outlook of when I was 40. And so, yes, I love the testosterone, love that shot. When I get that shot, girl, let me tell you something. When I go in there and I get that shot, that booster shot, woo!
It makes such a difference.
Carmen is good for a good week. Okay. It's
amazing. A small amount. And I think that's where people get freaked out about it.
Well, sure. You hear testosterone and you're like, what am I going to end up looking like, Hulk Hogan? Right. Am I going to end up looking like Hulk Hogan? So look at me, guys. I don't look like Hulk Hogan, but I feel like it when I go in the gym and I can pump my weights.
Exactly.
But no, it definitely brings back the vitality. It definitely, and the thing too, I think people need to understand is that we already have a certain level of testosterone in our body, like men and women. Anyway, exactly. So it's not like you're adding something to the body that's not already there. And as you mentioned, the levels start to drop as you get older. So it's just replenishing the levels back to I guess what you would call a
physiologic level, a normal range.
There you go.
So what happens is, when we think menopause, we think mid-50s. You're not thinking that has nothing to do with me, right? So,
well, I know because that's what I thought was happening to me. At 40. I was like, oh, really? Already?
Right. And it starts just probably in our late 30s. And that testosterone starts to get lower and lower, as well as the other hormones start to get lower and lower. And you're just like, am I losing my mind? Is something wrong with me? And we try to figure out, okay, do I need to work out harder? Am I changing my diet? Is it just stress? Even when it was me, I do this. And when it started happening to me, I'm just like, okay, I'm just stressed. Like it can't be hormones just yet, but lo and behold, it could be. So,
That's right.
you know, and it isn't something, these levels aren't something that are usually traditionally checked by doctors, right? So I tell people either ask for them to get checked or find doctors that may specialize in this and get them checked. Because there are patients that come in and they may be in their late 30s, early 40s, and it might not be their hormones. I'm like, hey, we might need to look at other stuff. Is it your
That's right.
thyroid? Is it something else? But if we get the levels and it's clearly that there's a deficiency there, let's do something about it.
That's
And if
right.
we could do something that are using, you know, plant-based, why not try it?
Yeah.
And while we're doing that, we're still checking labs and making sure we're not getting into dangerous territory.
Right.
You know, a lot of times when people hear, oh, you know, like you said, women are getting older. This is what you should expect. This is what it is. We don't have to live that way. And
I agree
we
with
have
you.
to know that there's different ways to treat things and to have an open mind.
I agree with you. You know, and that was something that I didn't buy either. I'm like, you know, I don't know why I'm feeling this way. I don't know what's going on, but I just don't accept this. And
Right.
and I know that there is a better way. And you don't have to live like that if you don't want to.
If you don't want to, right.
Yeah. And if you want to, fine, cool, do you.
Right.
But
Exactly.
me, no, I knew that I needed more of that spunk and that vitality back that I knew that I once had. So absolutely.
And it's not even just, you know, sex drive or weight loss or energy. I mean, it's a lot of different
But
things.
those are great benefits too.
Yeah, it is great. But it's like mental clarity. It's
Absolutely.
achiness and joint pain. You know, as we get older, we're like, okay, are my knees hurting? Are my hips hurting? What's going on here? And sometimes by fixing these hormones, it makes a world of difference in everything. It's not just what we typically think when we think menopause, you know, so that we need to do a little bit more research on and get that out of our head too. So.
Okay. Gotcha. So we just talked about a few of the myths as far as hormones, you know, bulking up like Hulk Hogan and all this other kind of stuff. Talk to me about some other myths that that there are about hormones, just so that we can educate the audience.
So with testosterone, you know, that you're going to grow hair all over, you know, that your voice is going to get deeper, that your hair is going to fall out, that all these things that, you know, with testosterone is all kind of stuff that I hear. And I'm just like, those studies that were done way back were on way higher doses that we're even dealing with. So I, you know, to look at that stuff and say, well, this is what I've read or I've heard, you know, that stuff isn't even valid anymore. And then with the estrogen, I understand, you know, with estrogen and breast cancer, unfortunately, you know, we're at 1 in 7 women get breast cancer, whether you're taking hormones or not. Those numbers are out of control. So right now, we don't know if a woman gets breast cancer, you know, it could be just how things were going to go. It's not directly related to hormones. Because if we said, oh, it's definitely directed to estrogen, when women get pregnant, our numbers go through the roof.
That's true.
Right? So if that was the logic, the numbers would be even higher, or it wouldn't make sense. Also, you know, we have those studies from back in the late 90s, early 2000s that was dealing with synthetic estrogen, where they were using horse urine and other stuff that right now, I think even the commercial companies are doing their estrogen a lot differently. So again, those studies from back in the day and what we've heard about estrogen, not really true, you know, and now we should all be getting mammograms and thermograms every year. We should be doing breast exams. We're watching you very, very closely. So again, just so much misinformation or old information that we have on hormones. So I think that that's a lot of it. There's so much old information out there or just misinformation, and we haven't caught up with the times, because even the commercial products now are a lot safer than the ones we had back then. And now lower doses can make a big difference. But if you can change your life and feel better with, you know, plant-based stuff like wild yams and, you know, non-genetically modified soy and plant sterols, and you're having somebody watch these levels very closely, why not give it a shot?
Yeah. Yeah. Absolutely. Absolutely. So the products that you use, are they the commercial ones, or are you talking, or are your products different? What makes your products different?
So we're primarily using the plant-based ones,
Okay.
you know, and a lot of times you hear people say, well, estrogen is an estrogen. And I'll give people that. But if we could get it plant-based, I think that makes a world of difference.
Mm-hmm.
And if it's, you know, that we're watching it, we're checking your levels and your doses. We're not just willy-nilly out here giving you hormones.
Yeah.
And the same thing, I use a lot of commercial products too. We're not doing just hormones now. We're checking levels and making sure you feel good, and then it's matching what your levels look like.
Yeah.
So
So what are some of your patients saying to you, other than me? What are some of them saying to you about their quality of their lives now, and what these hormones and the other treatments that you have at New Day has done for them?
I love what I do. I love what I still do the family practice. So I love what I do there too. But here I love it because we have women coming in sometimes at the end of their rope thinking, this is what my body is now. You know, this is what my life is now. I'll never get my spark back. I'll never get my vitality back. Something is wrong with me. And within 2 to 3 weeks, we're able to change people's lives. And they see that, hey, I can enjoy sex again. I enjoy being around people again. People aren't getting on my nerves. That they're happy. You know, we have, to me, it's our job to be happy in this life, right?
Yes,
and we have so much coming at us as women. And if we can have a little bit of help somewhere, some way, why not take that? You know, and why not capitalize on that and feel better? It shouldn't be that we get in our 40s and 50s and we're not enjoying sex anymore. Like, that's crazy. And I have so many women coming here and they're not having sex, and they're not even they're thinking that part of their lives is over. And it's not. Like, we could get you change, like have a totally different thought process, you know. And you know, Carmen, I'll get into a conversation about this stuff and I love it. Like, that's one of the things on my checklist. Are you having sex? And if not, is that by your choice? And is there something, can I change that in any way? Because I think if we all had more sex, we'd be happier. So.
Hey, I'm not, yes.
And I have patients coming from 35, and I have a lady that is 80 years old, and she's like, I'm here for my hormones. My boyfriend is younger than me, and I dare someone to take these things away. I've been doing this, you know, since I was, you know, in my 50s, and I dare them to take it away. So it's been around, and before you had to be in a certain class to be able to access this stuff, but it is around and it is here and it is changing lives. So we have patients that come in, they can now lose weight. You know, they can now think better. You know, they think, okay, do I have adult ADD? What's going on? And you may have that, but if you get the hormones, you know, it allows your medicine to work. And a lot of times we're able to get people off a lot of medicine. So that's just a blessing.
And I think that's key right there, to talk about how this hormone replacement, or the hormone, not replacement, hormone therapy actually helps get some patients off of the other medicine. Yeah, the other stuff that is not necessarily part of their body. So, you know, by adding things back to the body that was already there, helps some patients get off of some of this medicine that, you know, that they don't have to take anymore. So I think that's really key for a lot of people.
A lot of people. Yep. So I mean, we love it. I mean, at this practice, I mean, I get thank you cards and flowers from husbands and boyfriends and notes from patients that tell their friends. You know, we don't even do a lot of advertising. It's word of mouth of,
Sure.
Girlfriends at dinner parties or before COVID, just hanging with your girlfriends and say, girl, you need to see Dr. Black. I have people
Yes.
that would say they were in a Walmart line and somebody like, girl, let me tell you, I see you sweating over here. I'm gonna give you this card. You need to see this person. And they might not come right then, but they may flash back to a conversation that they had with somebody and say, I don't know why I'm really here. Someone told me that I need to see you years ago, and I realized that now is the time. I've tried a whole bunch of different things and nothing's worked, and maybe you can help. And I kind of smile inside and like, yeah, I gotcha. I gotcha. Oh yeah.
I love it. No, and you're absolutely right. I was just sitting there thinking back to that time, around when I was 40, and I wasn't able to sleep. Like I just couldn't sleep peacefully through the night. I could get to sleep, but couldn't really stay asleep. And I didn't want to do Ambien. I didn't want to do all that other kind of stuff in my body. And so the progesterone really helped with my sleep. So what I can say that they've done for me is just giving me an overall better quality of life. Right. Okay. I mean, I still have, things that happen to me, normal stuff that still happens to me. So it's not like it's a magic pill or anything, but it helps with just some of those smaller things in your life, but that really make a bigger impact. Okay. So getting better quality sleep. Okay. That allows me to wake up, not cranky in the morning, not wanting to kill people. Yep. Okay. So I'm in a better place. I'm in a better mood. I feel rested. I'm able to go to the gym, get my workout in. I'm not having to put in an hour and a half just to try to get the results that I can get out of 30, because now I got my testosterone levels back. You know what I'm saying? So, I mean, it's like it just overall improved my quality of life and just my mental clarity as well. So I definitely think it's something that a lot of women don't know about, or if they do know something about it, I don't think they know all the information of what's out there now. So I definitely think that this message needs to be spread. More people need to know about it. More women need to know about it, that, hey, when you hit your 40s and your 50s, it ain't over. Like
it ain't over, and you don't have to live with it.
It's revving up.
It's just beginning. We can get it going. Because I forgot to even mention the progesterone, because I love the testosterone so much. But like the progesterone is really just wild yam, right? And with that, it works on what we call the GABA receptors. It helps with sleep. It's a natural antidepressant, natural anti-anxiety. So imagine just wild yam freeze dried in a little capsule, and it's changing your life.
Yeah.
Like I don't even, I take my progesterone every night, and it's a game changer.
It is.
So there are some women that come in, maybe you don't need the testosterone, but you could try this progesterone and you have the best sleep that you've had in years.
Yes. Yeah, absolutely. Yeah. Absolutely. Definitely worth a try. Definitely worth a try to look into. So what other fun things do you have at New Day?
Oh, we do all kind of stuff. So, well, I guess it's not new. For the last 3 years, we've also been working on using radio frequency for vaginal rejuvenation. Yeah. So with that, I'm telling you, imagine you can get better orgasms, having less vaginal dryness, a better pelvic floor, which means, as we get older, even the incontinence, right? So again, I didn't think the incontinence issue would hit you until 50s or whatever, but I sneeze, cough, laugh, and I'm like, did I just pee on myself? Like, really? Have we gotten to the situation where I have to use a pad? Like, how? What the heck is happening here? And I'm like, oh, no. We need to do some research to figure out, how do we take care of this? And not everybody could do hormones, right? So let's say you've had breast cancer or a stroke or, a blood clot or something like that. Sometimes you can't do hormones, but you still want to improve your overall vaginal health. Or some people just don't want to do hormones at all. It's like, look, I don't want to put anything extra in my body, but there is something else going on down there and I don't feel like stuff is working. With this radio frequency, which is almost like a laser, but it doesn't have as much power as a laser, but it's still powerful. You're able to have more blood flow go to the area and have that tissue down there rejuvenated.
Wow.
I mean, it's powerful. And usually you could get a change after one treatment, but after 3 treatments, man, if we were not keeping this PG, I'd show you some pictures. We're getting cooches looking great. So you can be open and we get you looking tight without having labiaplasty or any surgery or anything like that. I mean, I have to forget sometimes.
Hashtag coochie look great.
I mean, because I'll just whip out the book and show people, and my husband's like, "Are you showing people pictures of vagina? You got to give a warning." And I'm just so excited about the changes and the things that we that we're doing that is minimal compared to what we think. In terms of cost and time and what we think needs to happen. I think we build up so many barriers because we don't know. But when people come in, they're like, so that's it? I could just try this and see a difference? And I'm like, yep.
Yeah.
And then once we got you, we got you.
Yeah, you got us, but you got us because it works and it improves your life. Now, I haven't did that, the vaginal rejuvenate, whatever that's called. We
got to get you in there because then you can tell everybody in Brand Stories world. You'll be like, okay, let me tell you, I have a testimony of Dr. Black's little purple machine over here. It is making magic happen. So.
Well, yeah, I'll get back to you on that one. But yeah, no, absolutely though. Again, just for women to know that there are options out there, there are treatments out there that will continue to help you live a vibrant, vitality-driven, filled life. I think that's important because, again, we get to a certain age, we believe this is how it's supposed to be. We believe that, things start going downhill from here, and that's just not necessarily the case. There is help out there, there's treatments out there, and it's just a matter of finding the right doctor. So again, you were saying that this is some of the stuff that you kind of go outside the box. So are there many doctors like you out here doing this type of work, or
there's starting to be more and more? So I started all of this about 15 years ago, and 15 years ago, I did feel like I was a unicorn, and a lot of people weren't doing it. And then, now I think that people know that it'll make people feel good. So you also have to be careful about people that aren't physicians or aren't in the medical field really capitalizing on this stuff.
Right.
So now you have big companies and corporations with no medical people in there, but they know, hey, if we could get women getting hormones and feeling great and even messing with men and you'll see now on TV, there's all kind of ads and stuff out there. It's getting more frequent. There are more doctors that are doing it that are qualified. I just say, make sure you just do your research on the people that are doing these procedures. Like I said, I've been doing this kind of stuff 15 years. Been a doctor for over, I can't even believe, 25 now. Just make sure that, it's not somebody that went to a weekend program or a course and they're like, hey, I could do this, just look at the credentials of people. But there are more and more physicians that are realizing, hey, if I change the quality of life of my patients and get to the root of what the situation is, we could really change lives here and make a difference and use less medications. And that's what people want nowadays. People don't want to be on medications, not even just for hormone stuff, but when we talk about, cholesterol, when we talk about blood pressure, I think that we've become a very lifestyle driven community, which is great. And
Right.
if there are things that could help us be healthier without some of that stuff, that's fantastic. Sometimes you're going to need it. And I'll tell my patients in a minute, it's time that we really use, the traditional medicines to get us where we want to be. And then we could try some of this stuff.
Yeah. Yeah.
But I think that medicine is, especially with the changes and just life, it's going into two directions. And it's going to be people that are really searching out, how can I live my life differently? And what alternatives do I have? And that's the key thing. We have alternatives in all of this stuff.
Absolutely. Alternatives and options,
options. Right.
Yeah. Agreed.
And with the internet, there's no excuse. Like now, get your Google MD on and start to look up stuff, and you'll see, wait a second, there's stuff out here that I don't know about. And then how can I find a reputable person that could help me get where I need to go or try some of these things with very little risk?
Yeah, absolutely. So as I mentioned earlier, you are a busy woman. You're running 2 practices, and you have, 2 teenagers at home and a dog and a husband. So and I asked you, how did you find time? How do you balance it? So you're a doctor, you got to take care of yourself. What do you do for self-care?
I've been meditating in the past, but lately, especially with this COVID stuff, I really realized that I need to take time, at least 10 to 15 minutes, if I could do it twice a day, to really meditate and get my thoughts and my thoughts in order and be able to release them and let them go. I got a Peloton, so now there's no excuse. The bike's right there, and it costs a heck of a lot for me not to get on there.
How is it? How is the Peloton?
I love it.
Yeah.
Like, it's inspirational. Like I said, it costs a good amount. So there's no just throwing clothes on it and letting it just sit there. Because every time you walk by it, it's like, I better get on that bike today.
Hello.
Yes. And this, really for me, that's been it. There's no excuse. And the way they build in the motivation, it's like, okay, I'm not going to mess up my streak, even if I have to do 5 to 10 minutes to get it in for today. It's making me do it. Yeah. And then there's just so many great, like there's, a Black people group, any group that you're a part of, there's a Peloton group for it. So it's motivational. It's like, okay,
there's a community. It sounds like there's a community aspect of it.
That's like cheering you on and making you do stuff, like, and then the music is good, so that, like, there was a Lauryn Hill ride, it's like, she may be late to everything, but I'm not going to be late to the ride. So, so
how you go
between the music and the people and the community, there's no excuse. And so, I'm on a 100-day streak, and I'm not going to miss it. So,
all right now.
Yeah.
Do this.
And that's good for me, because usually if I got to go somewhere, it ain't happening. And if it's in the morning, I'm trying to get my sleep because I didn't go to bed till 2. So
that's good to know.
I walk by and I'm like, okay, it'll be 11:52, and I'm like, let me get my ride in for today. So there's no excuse.
Yeah. So you meditate and you exercise.
Yeah.
What else do you do for self-care?
Really, I'm telling you, COVID just really messed stuff up, because to me, some of my best outlets is getting with girlfriends, like face to face. Like, there's only so much Zooming that you could do, but you need that person to be able to bounce stuff off. You need that person that'll tell you when you're wrong, or when you look tired, or when something ain't right. You have those girls that could look at you and be like, okay, what is happening? Because you don't see yourself.
Yeah, it's that intimacy.
So I'm excited for that to get back. Because I think we need that. We need that human touch.
Yes.
We need to take care of one another. So I think that's part of my self-care too, that I really miss. I miss seeing my girls and seeing my friends. The exercise, the meditation is key, because there's just so much stuff.
Well, yeah. I mean, when your thoughts are not right, then everything else is crap. If your thoughts are crap, everything else is crap. Your results are crap. So yeah, so getting that piece together, the thoughts, getting that in a grounded place and being aware of what you're doing, that changes everything. So it all starts from there. So you, like my really good close friend Tiffany, loves Prince.
Oh my gosh. Yeah.
I don't know who is the biggest. I'm gonna have to figure it out one day. I'm gonna have to put you guys in a competition and figure out who's the biggest between y'all two.
Wait, I had Prince in the background, and then Ty was like, "You want to maybe change that?" And I was like,
"You should have left it.
I'll put my plant there." So he's right here next to me. So,
but that I know about you. What is it about Prince that because I love LeBron James, so
right.
That's my Prince. Well, no, that's my king. Not king, but king.
Right.
That's my king. So tell me, what is it about Prince?
Just the creativity. He's a genius. You could go to, a show 3 nights in a row, and each show would be distinctly different.
Yeah.
The fact that he had so much talent out there, and we didn't even know the hands that he was into, but just all of it. I just think he was a creative genius that really left the world in a better place.
Yeah.
So
yeah.
I miss it. Like, I'll still listen, and my daughter is like, can we get over this guy? Because I'm like, when they open up everything again, we got to go to Paisley Park. We got to go back to Minneapolis. And she's like, that's not a vacation to me. Too bad.
Right. You're going.
Yep. It doesn't matter.
Yeah, no doubt. I mean, he definitely was a special one, and his music was, a true artist.
So much music that at each part of your life, there's a Prince song that can match that.
Girl, let me tell you, I remember.
So, you could go,
I remember singing
Rain when we knew like we shouldn't have been seeing it because it was rated R.
No, that's what I was going to go to. I remember seeing that movie, and I remember singing, is it Little Nick?
Yep, Little Nicky.
Little Nicky. And I remember singing that, and I don't know how old I was, but was not old enough to know what I was singing. And my mom, she was like, what are you singing? I'm like, it's Prince. And she's like, no. Right. And I can't remember when it was that I finally remembered to like look up that word.
Yeah. I mean, there's so much. And you're just like, oh, right. It's just like, what? I mean, from high school, like listening to Adore to, for him to do the soundtrack of Batman, like there's so many things that we don't even realize. He was way beyond his time.
For sure. And to be so sexy, but sensual in a very classy type of way, if that makes sense.
Right. Because in what other circumstance would we think a guy with sequin jackets and heels is sexy and like you have like what?
What sexy man can rock a blouse?
Right. So it's just
a ruffle blouse.
All of it,
A ruffle blouse. Absolutely. Nah, amazing. Definitely. I enjoyed this, Kristin. We could talk for days. There's so much for us to talk about. One day we'll come on and we'll talk about Abraham and blow everybody's mind.
Oh.
You think they're ready?
Oh. That'll blow everybody away. Because let me tell you, I done manifested some stuff last week. Girl,
Same.
It is. We need to get on that because that is unbelievable. You think these hormones and all this other stuff will blow your mind? Being able to manifest and really put that law of attraction into the universe, it brings so much to you, and you don't even realize.
No, not until it's happening, and you ask, and you're like, "Whoa, wait a minute! I put this out, a year or so ago."
Yep.
Put it out there, left it alone, forgot about it, moved into that vibrational frequency, and now it's here.
Yeah.
And you're
so it'll blow your mind. Like, yo, we got to do that.
Absolutely. Absolutely. I definitely think that, I mean, a lot of people know about it. A lot of people are already practicing it. But I just always found it cute when we both found out that
Oh,
we
yeah.
were Abrahamites.
You gotta be careful. Even now, we gotta be careful because we're like, what the heck are they talking about? And even when you tell people at first, was like, this is what you do. This is what you're thinking. And I'm like, okay, you don't do it. You're lost. More for me is all in here.
That's it. Always, always. Yes. I loved it, Kristin, so much. Will you tell my listeners and viewers where they can find you to get more information?
All right. So again, New Day Wellness, newdaywell.com. And my practice is New Day Wellness Center in Charlotte. And if you need a regular family practice and you have family down in South Carolina in Lancaster, New Day Family Practice. Can't let you go. Talked about those hormones. Oops, bring it.
There it
is. Talked about testosterone.
Testosterone. There it is. What's the author? Kathy C. Malpin? Malpin. There you go. You guys check that book out if you want to know more about female hormones, especially testosterone. I'm trying to tell you, change your life. It's a game changer.
Carmen, I need a part 2. I didn't even get into the O shot and P shot. So you got to have me on again.
O shot? What's the O shot?
Ooh, buddy.
Is it an O? Is it a big O?
It's an O. So you add all this stuff up together. So next time we'll just start off with straight up sex talk with Dr. Black.
Oh,
how we can improve your sex life now.
I love it. Let's talk about sex, baby.
Yeah,
that's what we're gonna do.
I like that.
Yeah, so that's what we'll do.
Come on, brand ambassador, come help me now. I've been waiting.
I'm ready.
Put it in the universe. I'm putting it in the universe. Carmen's gonna change my life. So we're gonna be out there, Dr. Black and Carmen, bringing sex to everybody. Let's get your O on.
Woo! I've always wanted to bring sex.
Yep.
Stop it. You got me acting up. I love it. I love it.
This was so much fun.
Great. I'm glad. I mean, again, all seriousness, everything you're talking about is to help women, have a more vitality life. And so I just hope that they definitely check you out. If anything, do your research, read the book, and check her out on Instagram, Facebook, all of that good stuff. What's your handles?
Yep. So, I don't know. Instagram just kind of started. Just put in New Day Well or Kristin Black and it'll come up.
Don't worry. I'll put it in the show notes, you guys.
Okay.
So you'll be able to find it.
Kendall, my daughter is like, you use the mom filter. You are so corny. And I'm like, then do it for me, Kendall. She's like, I'm not talking about sex. I'm 12. And I'm like, okay. All right. So that might be a good thing.
We need to get Kendall on the show. That's who we need on the show.
Oh, I don't want her yet. She'll totally blow me up and be like,
Awesome. Awesome. All right. Well, thank you so much. Look forward to part 2.
Yes, that sounds good.
Awesome. Talk to you soon.
Okay. Bye-bye.
All right.